We've reached the part of this semester where the remainder of this semester is going to be pretty repetitive. So we're going to talk about cranium in the context of just the skull, and then we're going to talk about facial bones, nasal bones, mandibles, sinuses. And what you're going to find is that in most of the sections that we'll test on, there's some commonality between the different projections that we're going to utilize. Now, there's going to be some differences in those, in that for the specific anatomy that we want to see, we might focus our attention and put the central ray in a specific place with specific collimation in order to visualize that anatomy. And there will be differences between the projections, mainly in those parameters. So central ray location collimation would be different for different projections. For example, if what we're interested in seeing is the lateral of the nasal bones. The nasal bones are very small, and they only form the bridge of your nose. So they articulate at the top with your frontal bone. That's a big bone out front, and where your frontal sinuses are. But that it articulates all the way up the top. So we want to see all the way from the frontal nasal suture down to the tip of the nasal bones, which are about halfway down your nose, so just distal to the bridge of your nose. So our collimated field for a lateral of the nasal bones is only going to be about 2 inches by 3 inches maximum, and it's just going to center on that area, and we can take those tabletop. Textbook positioning for lateral of the nasal bones is going to be identical to textbook positioning for lateral of the skull. The steps that you take and the lines and the planes that you have parallel to the image receptor and perpendicular to the image receptor are going to be identical for both of those projections, lateral of the nasal bones, lateral of the skull. But for lateral of the skull, you need from the frontal bone all the way back to the occipital bone, which is the bone all the way back in the back, and from the very top of the skull, what we call the vertex of the skull, where our two parietal bones come together, all the way down to the horizontal portion of the occipital bone, or the basilar skull portion. So our central ray location is going to be vastly different between those two. For lateral of the nasal bones, it's going to focus right on the nasal bones. For the lateral of the skull, the central ray is going to be about 2 inches above where your ear is. So positioning wise, though, they're identical, and if you can do the legwork to identify positioning for each one of the projections that we're going to discuss, then all you'll have to do is dial in the specific central ray location collimation for the exam that we're going to be discussing in the different sections. That's not to say that there aren't new projections for every section or modifications to projections for every section that we're going to talk about. But the fundamentals are going to be there, and we're going to talk about the same projections in different anatomy types throughout the semester. So learn them up front, and it'll make it easier to get through the rest of the semester. Anatomy-wise, we're just going to talk about the skull today. We'll talk about the facial bones when we get to the facial bones. We'll talk about the mandible when we get there. So the skull itself is composed of 22 separate bones that are divided into two groups. Facial bones and cranial bones, and we're going to focus on the cranial bones today. So there's 8 cranial bones. So we subdivide the cranial bones themselves into 2 sections, calvaria and the floor. So the skull is, you'll hear it referred to as a diplo type bone, and basically all that means is, most of your bones are really kind of diplo, except for your lung bones are cylindrical. So instead of having just 2 separate plates, what you've got is a continuous ring of bone with a spongy bone in between. So with the diplo, what you've got are 2 hard inner and outer plates, and then you've got the spongy bone in between. The flat bones of the skull are part of the red marrow containing bones that help to create red blood cells. So your flat bones are responsible for creation of most of your red blood cells. Bones of the skull, bones of the pelvis, bones of the sternum, things like that. On the test, you're going to have to identify bones from a lot of different angles. So from a frontal aspect, like what we're looking at here, from a lateral aspect, and then from an axial aspect, where it's as if they sawed off the top of the patient's head and you're looking down inside of it. So we're going to have you label. On the test, there's quite a bit of labeling. You're going to have to label the bones and sometimes label sub-portions of the bones. So I'm going to magnify this up a little bit so that we can see it a little bit better. So that's about the best I can magnify it. So what we have is frontal bone up front. We've got the parietal bones, which are the bones off to the side that attach at the very top of the vertex of the skull. You've got the sphenoid bone, which is really kind of behind the eyes, and it has at its articulation with frontal bone different holes in it where you've got your optic nerves and fissures for passageway for the organs of sight to pass through. So you got sphenoid bone. You've got, and that's this superior orbital fissure. You got the optic foramen, which is right there, and that's where the optic nerve goes through. You've got your temporal bone, which is right over here. Your temporal bone is named because of its proximity to the temple itself, which is, the temple itself is really an area of fusion where you've got a couple of different bones that come together, sphenoid and temporal bone. But you've got the tympanic membrane and everything that goes, the organs of hearing go through the temporal bone. So we've got different portions of temporal bone you'll have to learn as well, and we'll talk about that shortly. So this portion right here is what we call the glabella, and the glabella is an exit point for the central ray or an entrance point for the central ray, or it is used to locate an entrance point for the central ray on a lot of the different projections that we're going to discuss. So pretty much right in between what we call the superciliary arches, which are the arches right above the eyes, right below the eyebrows. You've got nutrient foramen as well. You've got a supraorbital foramen here. You've got an infraorbital foramen down there. And what a nutrient foramen is, it's just a hole in the bone so that blood vessels can get through it. So some other areas of interest that you'll need to learn are just below the glabella. You've got the point where the nasal bones attach to the frontal bones. That's what we call the nasion, and the nasion is another point where that we'll use for positioning. And then down here at the bottom of the nose is what we call the acanthion. The acanthion is basically where both pieces of the maxilla mash together to create this little range of raised tissue right here, and it's the bottom of the nose attachment. And we've got the glabella up here, then we've got the nasion here, and then we've got the acanthion down here. So from a lateral standpoint, again, we got the glabella. That's where the superciliary arches kind of come together. Nasion, and then acanthion down here. So looking from the side, we've got specific points you're going to need to know as well. Like we've got frontal bone here. We've got the bregma, and the bregma is where we've got two sutures that come together, and it's at the top of the head. So your coronal suture is a suture that joins your frontal bone with your parietal bones, and it goes across your head from side to side. The bregma is where the very tip of that coronal suture is, and it's where the coronal suture meets with the sagittal suture. And the sagittal suture is a point where the two parietal bones meet. So you got this suture that goes straight back, and it parallels that line right there, and then you've got one that goes up and down on both sides of the skull. So this would be your coronal suture, and that would be your sagittal suture. And the point where those two sutures meet is what we call the bregma. All right, so looking at the bones, you got the frontal bone, you got the parietal bone, you've got the temporal bone, you got the sphenoid bone, and you've also got this point right here where you've got this squamosal suture that joins up with the suture that joins the sphenoid bone and the temporal bone together. And that's what we call the pterion. Now notice the spelling of that is P-T-E-R. And just like the winged dinosaur, the pterodactyl, the P is silent. The pterion is silent, and anytime you see that P-T-E-R, then you need to make a mental association with the sphenoid bone. And we're going to look at the sphenoid bone in just a minute, and it looks kind of like a winged creature of some sort, kind of like a bat. It's got a couple of wings that come off of it. It's got a lesser wing and a greater wing, and it is given the name sphenoid bone, but it's got different projections off of it that start with that spelling, P-T-E-R. And it's the only bone in the skull that has that spelling. So when you see things like pterygoid process, that's P-T-E-R-G-O-I-D, pterygoid hamulus, all of those are projections off of the sphenoid bone. So you got sphenoid bone, you got temporal bone. Your occipital bone is this bone all the way back here in the back, and it's got a suture that joins it to the temporal bone and to the parietal bones, and that is what we call our lambdoidal suture. So a lambda in the Greek alphabet is kind of triangular shape. So looking at the bone from the posterior surface, that suture kind of takes on a bit of a triangular shape to it. And that's why we call it the lambdoidal suture. So that's the lambdoidal suture. The occipital bone is the whole bone, and it wraps all the way around, and it joins back up with the sphenoid bone. So it wraps up underneath. And whenever the patient falls down and they crack that bone, it's what they call a basilar skull fracture. This knot right back here, and it's not real well drawn, but you can feel it on your own head if you put your hand on your occipital bone and kind of run it down until it kind of disappears into just a little bit of a soft tissue indentation. That is that little knot before it goes inward is what we call the external occipital protuberance, also known as the inion, I-N-I-O-N. The place where the mastoid process the temporal bone, mastoid process is a portion of the temporal bone, joins to the parietal bone and the occipital bone is what we call the asterion. So this right here is where your organs of hearing are found, and your organs of hearing, the hole that gets the sound into your skull is what we call the external acoustic meatus. It's also referred to as the external auditory meatus. It's the ear hole. And just in front of that, you've got a styloid process where you've got attachment for the sternocleidomastoids, some of the muscles and ligaments that kind of control the motion of the head and motion of the mandible. So the bones of the cranium, again, you got them divided out into two different portions. You got the calvaria and you've got the floor. So what forms the floor, or the bottom of the skull, the cranium, would be your ethmoid bone, which we hadn't taken a look at yet. You've got the sphenoid bone, which we've talked about, and it's more internally. The temporal bones are the bones, again, at the temple, and they form towards the bottom lateral side of the floor of the skull. Then the calvaria, the top portion, the upper portion, would be your frontal bone, your occipital bone, and then your two parietal bones. So if we were to take and saw off the very top of the patient's skull and lift it off and look down into the skull, this is the view that we would see. Of course, after taking the brain out. But what we've got is we're looking down on the floor of the skull. So if we cut through the frontal bone and the parietal bones and the occipital bone, what we're left with is the occipital bone here, and then we've got the temporal bones here, we've got the sphenoid bone here, we've got the very top of the ethmoid bone, and then we've got the frontal bone. That's the horizontal portion of the frontal bone that we're seeing here. What we have then is the anterior, this frontal bone up here, anterior, middle, and posterior cranial fossa. So what you need to pick up out of this is a number of different things. One is that very top portion of the ethmoid bone, and that point is what we call the crista galli. And it's basically an anchor point for the covering of the brain, but is continuous with what we call the cribriform plate that goes into the top of the ethmoid bone, and is continuous with the perpendicular plate that comes out of the bottom portion of the ethmoid bone. That's continuous with the bony nasal septum. So we've got the horizontal plate of the frontal bone. This refers to the orbital plate because the orbits are right up under there. And you've got the two wings of the sphenoid bone. You've got the lesser wing, which is on top. It would almost seem like the lesser wing would be on bottom, but this is in reference really to the size of the individual wings. So you got a lesser wing, and it's lesser because it's smaller. And then underneath that, you've got a greater wing of the sphenoid bone. Right in the middle of the sphenoid bone, you can't really see it, but what you've got right up under this structure right here is the sphenoid sinus. This structure is what we refer to as the sella turcica, and this is where your pituitary gland sits. And it has its own subdivisions as well, the sella turcica does. So what you have are off of the anterior portion of the sphenoid bone, or anterior portion of the sella turcica, projecting posteriorly are the anterior clinoid processes. And these little two things here on the back side, they're projecting anteriorly and superiorly, more superiorly than anything else, are the posterior clinoid processes. So on a lateral view, what you see is that U-shaped structure that we see on the lateral of the skull, and that is our sella turcica. This entire area back here is what we refer to as the dorsum sella, and then that line coming back down from the dorsum sella all the way into the foramen magnum is what we call the clivus. You've got a few other openings in the sphenoid bone in addition to those on the anterior side that allow the organs of sight through. You got the foramen ovale over here, and you've got the foramen lacerum over here. Really, you've got two of each on either side. Of all of that, the most important thing to be able to pick out would be your sella turcica for evaluation of rotation and its proper placement. So now we're onto the temporal bones, and we got on the temporal bone this ridge of bone here that looks really not all that impressive on this particular image, but it is the densest portion of the skull. It's what we call the petrous ridge, sometimes referred to as the petrous pyramid, petrous portion, and the pars petrosa. All of those mean the same thing. So on the test, don't get all confused and uptight about the spelling or the word differentiation there. They all mean the same thing, and that's that ridge of bone here. That ridge of bone is largely what we're going to use to identify proper positioning on most of our projections. It's going to appear somewhere. We're also going to use it to evaluate rotation. So just be familiar with that terminology, so that if it changes throughout the projections and throughout the book, it doesn't rattle you. Then you've got the occipital bone. Occipital bone from this angle really is pretty non-spectacular. You've got the foramen magnum, and that's about it, really. So the joints in the skull are what we refer to as sutures. So the fibrous joints that connect the bones of the skull together, and we've got the coronal suture, and we talked about that. The coronal suture joins the frontal bones to the parietal bones. We've got the sagittal suture, and that joins the two parietal bones together. You got the squamosal suture, and that joins the temporal bone and the parietal bones. And then the lambdoidal suture joins the parietal bones with the occipital bone. We also took a look at these. The bregma is the junction of the coronal and sagittal sutures. The lambda is the junction of the sagittal and lambdoidal sutures. Now, fontanelles are just the soft spots in the skulls. Now, purpose for the fontanelles, and the reason the skull is not fused at childbirth is to give the skull, and this seems really brutal, but it gives the skull room to move as it moves through the birth canal, so it can actually compress as it moves through the birth canal. Those sutures should fuse in time, and the fontanelle should completely seal up, so you got a solid bone at some point. Still identifiable as distinct and separate bones, but since there's such a strong fibrous bond on those, they function as a single bone.